All right, and welcome back to Unit 7. This is the last lesson of Unit 7A, which is on the effects of stress on psychological functioning. And I'm just needing to full screen here. There we go. So this is following up to responses to stress. Now we're talking about the responses to stress on a psychological level, how it affects you and your functioning. So the first two areas you want to know about how stress impacts you psychologically is with impaired task performance. So there's a theory called Baumeister's theory. It's basically known as the choke theory, and it's the core idea that pressure makes people self-conscious, which diverts their attention and concentration, and then they choke. Imagine that you're doing some kind of performance-based task, and in the moment you get very caught up on thinking about your skills and your abilities. So let's say that you are in a big basketball game and you get fouled. You go take some foul shots, and when you walk up to the line, you begin to really feel the weight of the pressure. It's not that you can't make the shot. You know how to make the shot. You've made the shot millions of times before. But in that moment, the pressure, the added pressure, actually makes you self-conscious. And so in doing that, making you self-conscious, you divert your attention and your concentration. You start thinking half about your abilities, to be able to successfully make the foul shot. And then the other half is actually thinking about just making the foul shot. And as a result, in that moment, you choke and you miss both foul shots. Your team loses. You lose out on the title. Game over. So that's Baumeister's theory. Basically, just think about it associated with choking and diverting attention. The other way of impaired task performance is through burnout. Burnout is when you basically become physically and emotionally exhausted. That's brought on by gradual experience to a long chronic work stress or job related stress. So burnout, you might hear about like teacher burnout or nursing burnout, especially right now during the COVID-19 crisis. You have people who are working extra hard, nurses, people who are working in nursing homes, people who don't have access to the PPE that they might need. And the burnout will probably be quite strong when this is all said and done. Some people are going to be so exhausted. Some people are going to be exhausted to the point of giving up the career and moving on. Maybe because they feel underappreciated, maybe because they were just overworked and high stress. They put their life on the line and they no longer feel that that's something that's worth it. So typically when people are burning out, and it's possible that you might have experienced even a teacher who was burnout or burning out over the course of your school career. It's actually very likely because of how many different teachers you've encountered. The teacher burnout rate is about 5 years. So within about 5 years, there's like a quarter percentage of teachers that actually burn out and totally leave the profession. So that's pretty high, but there are other professions that have burnout rates even faster than that, like somebody who rides in like a paramedic, an EMT. Their burnout rates could be 6 months to a year because of the amount of trauma that they have to constantly get exposed to and are called to. Think about like car crashes, fatalities, violent acts. This is a high level of trauma, and so some people just can't take that and they can burn out quite fast. I want to show you actually some of the stages of burnout. I'm not going to really read them to you or explain them, but I want you to just take away the idea that burnout happens over time, and sometimes it starts with setting really goals that are too strong or too high. You have a lot of ambition, and that's pushing you to work and throw yourself at a job or a task really, really hard, and over time it starts to cause you to be so involved in that you neglect some of your own needs as a human being. And as a result, you can look at the list and see some of the changes. But stage 12 is when you hit burnout. And so, like I said, pause it, look at it if you want, but it's fairly enlightening. All right, let's keep going. Another area where you see the effects of stress on you psychologically is with psychological problems. So it can contribute to poor academic performance, can lead to sleeping difficulties with insomnia, could lead to sexual difficulties, could lead to drug or alcohol abuse. From a mental illness standpoint, stress can trigger things like depression, it can trigger schizophrenia, post-traumatic stress disorder, as well as other anxiety disorders. There are some positive effects of stress. Usually they're kind of taking a backseat to the negatives because it's easier to focus on the negative impact of stress psychologically. But think about how stress in a healthy sense could help you realize some good things. For example, how you could grow personally or professionally, how you could begin to start reevaluating your priorities and your skills and figure out how to hone in on those. And also building up resistance, where you start to realize like how you can adapt to things that are difficult and then adapt to stress in a healthy way and get better from that. So resilience is a good thing. Now, also, I want to show you some effects of stress on physical health. So, of course, there's a correlation with psychosomatic diseases as well as heart disease, likely triggering something such as a heart attack or heart disease in the first place. But those people are typically broken down into two groups: type A personality and type B personality. The type A personality person is often more competitive, more hostile, more impatient in regards to time, whereas the type B personality is a bit more relaxed, more of a patient individual, kind of easygoing mentality. Well, type A people are more likely and more susceptible to experience heart disease because of their competitive drive, their impatience, their more hostile nature. They're going to throw themselves at stress in a more difficult way, and they're going to be more likely to experience stress because of the way that they hold themselves accountable to certain tasks. Type B personality people still can get stressed out, but because of their more relaxed, patient, easygoing demeanor, they're not as likely to give in to the ill effects of stress. Also, you may notice that in times where you get sick and you're also stressed out, there's a link there. So the body's immune response, the defensive reaction to bacteria or viral agents, is actually reduced during times of high stress. So stress reduces your level of immunosuppressing abilities. Your immune activity is weakened. So it wouldn't be uncommon for you to feel really stressed out and then also catch a cold. It's actually fairly normal. So overall, there's a modest link. You can see the correlation coefficient down there, 0.2 to 0.3, between stress and health, linking again modestly. Let's talk about some factors that moderate the impact of stress. When some people get stressed out, they want a huge social network. They've amplified their social network to give them a lot of buffer and a lot of support. And in this case, that's actually a good thing. People who have more social support are actually much more likely to handle their stress and moderate the impact of stress in a positive way. People who are alone or want to go at things alone are more prone to tackling stress in negative ways or unhealthy ways. When you get stressed out, those that are optimistic generally are seeing a more favorable response to stress and the effects on their body than those who are more negative and cynical. But it is very easy to embrace cynicism and negativity, especially if you have a type A personality. And then lastly, just general conscientiousness. If you're aware of the impacts of stress and what stresses you out and what you typically would do when you're stressed, this automatically puts you in a better position than if you're someone who has no conscious nature of understanding what stresses them out, how they typically deal with it. That sets you back. So you can moderate the impact of your stress better if you're a more conscientious person, if you're more disciplined, and if you have some understanding about your stress in general, where it comes from, and how you handle it. Some general unhealthy behaviors that are sometimes linked with stress, but not always, are things like smoking, poor nutritional habits, lack of exercise. These are all very common sense based things, so nothing to really explain there. This is actually a diagram showing heart disease death rates from 2008 to 2010 in adults, age 35 by county. In the South, there is a very prevalent level of heart disease, and that is not a good thing. But again, you can pause here if you want to look at it more. Other unhealthy behaviors or health impairing behaviors are related to alcohol and drug use, unsafe sex practices, AIDS and HIV. Again, nothing really new to say here. You can, of course, look at all this stuff. But one thing to think about is, where do health impairing behaviors come from? And so typically health impairing behaviors, they don't just come out of nowhere. They creep up slowly and then they become impactful. Also, health impairing behaviors may have seemed like a good idea at the time, but actually not so much. But in the moment, somebody wasn't thinking about the long-term effects. For example, like number 4 says, underestimating risk application. People don't generally smoke cigarettes and then think, I bet I'll probably get lung cancer in 20 years. The same way that people don't do something else that's unhealthy. You know, I think I could use some drugs and I'm not going to be someone who overdoses and dies. And the reality is, statistically, it happens to people. And so underestimating risk application to themselves, even right now with social distancing and people who are not social distancing or not wanting to wear masks, and they want to go out in public and they want to get back to work and be in the world. That's all great, but part of it stems from underestimating risk to themselves. A lot of people probably think they're going to go to the grocery store and be just fine because other people are doing what they're supposed to do by wearing masks and by walking down the aisles in one direction and being conscientious of people around you and health and yada, yada, yada. Most people are not living their life thinking they're going to be someone who gets COVID-19 and gets really sick and maybe has to go on a ventilator and maybe even possibly dies. That's just not a type of thought that people generally have. Now, if you have a compromised immune system or some risk factor that makes you more vulnerable than others, maybe it is a thought on your mind. But generally, when it comes to unhealthy behaviors or health impairing behaviors, people always underestimate risk as it applies to themselves. Okay, one little bit of a tangent there. I skipped over number 3. Chronic disease is a long time in the making. So as a health impairing behavior, chronic diseases, again, by chronic implied, it's not just springing up out of nowhere. It's not creeping up slowly. It's been a long time in the making. All right, let's keep it up. Where are we at? A couple of reactions to illness. In class, I think people find some humor to this. I don't know if I'm going to be able to convey that to the webcam, but there are so many things that people do wrong when they go to the doctor. They have reactions to illness. First off, people want to delay treatment, okay? Everybody gets on Wikipedia, not Wikipedia, WebMD, Mayo Clinic, whatever it is, Healthline, medicine. They want to know, all right, these are my symptoms. I'm going to type them in real fast, what's coming up. What's wrong with me? I don't want to look silly if I'm wrong, so I got to make sure I understand, even though you're not a trained medical professional. I don't want to bother my doctor. If I call my doctor up and, hey, I've got this headache, should I do something about it? I don't want to look silly. I don't want to bother my physician. I don't want to interrupt my plans. I planned on going to the movies and getting a haircut and getting some food. When am I going to schedule time to go to the doctor? Who knows? So I don't want to interrupt stuff. And I don't want to waste time on trivial matters before going into the doctor. People want to delay treatment. They misinterpret symptoms. They downplay their symptoms. They delay going to the doctor as long as possible. For some people who don't even have access to a primary care physician, they wind up then in the ER or urgent cares because they never went through any of those other steps, which could have prevented that expensive ER visit in the first place. Then let's say you actually make it to the doctor. Now we're on number 2, communication issues. People go to the doctor and sometimes they lie. Doctors are trained to go through a gauntlet of questions to help rule out stuff. A lot of medicine is actually ruling out what it's not to isolate what it possibly is. And so when you go to the doctor and they're asking you questions about your health behaviors and your unhealthy behaviors, your healthy behaviors, some people, what do? They lie. Doctors ask, have you used any drugs? Are you sexually active? Are you a drug user or alcohol consumer? Do you smoke? And people will lie. And why they do that is a lesson for another time, I suppose. But there are many communication issues. And because they lie to their doctor, they might get an incorrect assessment or an incorrect diagnosis. And then you have step number 3, adhering to medical advice. People go to the doctor. They sit in there. They listen. They nod. It seems like they're understanding everything, but they may not understand when they leave. That's why these days at doctor's offices, they give you a printout material of a whole bunch of paperwork explaining a lot of the stuff that was probably shared to you. And so people who don't understand what's going on cannot have a very easy time to adhere to medical advice. In fact, it's the whole opposite is what they experience. They don't know the instructions. If they're unpleasant instructions or if they're difficult, this hat is really itchy. I don't know why. I should just take it off. But people who try to adhere to medical advice that's unpleasant or difficult to understand, they begin to develop hostility towards their doctors, towards their physician. The doctor called me fat when actually they said, look, if you're comfortable with your body weight, that's great. It would be helpful to you probably if you were to use some healthy behaviors like exercise and working out. But if you're happy where you're at, then you're happy where you're at, And somebody leaves and says, I'm never going back to the doctor. They called me fat. When in reality, that's not what happened. So something to think about. And all right, last slide. So what can you actually do to improve stress management? Me personally, I like to use humor. It's just part of my personality, and everybody likes different things. But the big takeaway here would be rational emotive behavior therapy from AE, Albert Ellis. The idea is simply you feel the way that you think. Let that sink in for a minute. You feel the way that you think. Okay, so rational emotive behavior therapy is trying to suggest, as a stress management tool, you can't just avoid your stress. If you're constantly cynical, catastrophic thinking, negative all the time, you're going to eventually feel like a negative person. You're going to feel like you've got this mountain of stress that you can't get over. And that's just simply not true. So when you feel the way that you think, if you approach everything with a dose of cynicism and negative thinking, after a while, you're going to just become a negative Nancy. And so a better way of thinking is using rational emotive behavior therapy to change the way that you're thinking. Reappraise the scenarios. You know what? This doesn't have to be as bad as it is. Yeah, moving across the country sucks and I'm going to lose all my friends. Okay? You don't have to think of it like that. First of all, you don't have to lose your friends because this is the age of social media, digital media, and connections and networking. So you can still maintain your friendships. It's true you're not going to see each other every day, but you'll get over that. If you're reappraising, you might think, you know what? This gives me a new opportunity. Yes, I'm moving, but I get a new opportunity to establish the identity that I've always wanted for myself. So I can be the person that I now feel most comfortable being, and then I'll form relationships off of that. That is a positive way of thinking about this, and likely a more healthy way of managing the stress. And so you can look at some of the other ones here. They're more common sense based. But again, that's all I've got for you. This is the end to the first half of Unit 7. You've completed Unit 7A if you've watched this video. And so the next video will work on Unit 7B, which deals with personality. As always, stay healthy, and I'll see you next time. Adios.